Hello and welcome to your daily Sex IQ question at 5MI Weekly. Today's question concerns gynecology. Before sharing today's question, let's do a quick recap on what we've learned thus far from your Sex IQ test. We've learned the average age people are first engaging in sexual intercourse, the percentage of men having extramarital affairs, the percentage of women who have engaged in anal intercourse, the probability of transferring HIV during anal intercourse, the hardiness of HIV, the biology of personal lubricants, how expansive sexual experiences are, the fallacies of gaydar, the relationship between menstruation and pregnancy, and the effectiveness of birth control. What will we be learning today? True or false? Unless they are having sex, women do not need to have regular gynecological examinations. Give yourself a point if you said false. 85% of Americans got this question correct in 1991, and 91% of Americans got this question correct in 2016. Most fertility concerns for women occur before they're having sexual intercourse. With the average age a woman is having sexual intercourse for the first time being 17 years of age. The American Congress of Obstetricians and Gynecologists recommends a woman's first visit to the gynecologist to be between 13 and 15 years of age. For the first visit, the gynecologist is likely not to do a pelvic exam or a pap test. Instead, in order to get to know the patient, the gynecologist will ask lots of questions about family, vaccines, ovulation, menstruation, and any sexual activities. Additionally, during this first visit, the gynecologist will perform a physical and an external genital exam. The physical is no different than an examination one would get from any other doctor, checking height, weight, blood pressure, and any specific health concerns. The vulva, or external sex organs, are examined during the external genital exam. Good gynecologists are highly interactive during this exam and will give the patients a mirror to confirm the patient is aware of and knows each of the parts of their vulva. Future visits to the gynecologist will include a pelvic exam and a pap test. The gynecologist examines the internal sex organs during the pelvic exam. To check the internal sex organs, the gynecologist places 1 or 2 gloved and lubricated fingers inside the vagina and up to the cervix to feel the organs. To perform a pap test, which tests for cervical cancer, the gynecologist will use a speculum and take a sample of cells from the cervix with a small brush. So what does all this mean? The gynecologist can be a great resource for the female, not only for her physical sexual health, but also for her psychological health, especially as it relates to addressing questions about the biology of sex and sexuality. That's all my time for today. Be sure to keep a running total of the number of questions you've answered correctly and the type of question you've answered correctly as well. Today's question was a biological type of question. See you tomorrow for Sex IQ question number 12, a biological question about testicular cancer.